everyone. My name is Huxley and I'm here with Robin Faulkner today. We are second-year medical students at Comp Northwest, and we're going to be talking to you about the rates of hospital-acquired Clostridioides difficile infection in 5 Samaritan Health Service hospitals during the COVID-19 pandemic.
So Clostridioides difficile, also known as C. diff, is a bacterial infection causing severe diarrhea and inflammation of the colon. C. diff represents a substantial burden on healthcare systems and patients, including increased risk of mortality and increased economic burden. Hospitals and other hospital settings are a common site of transmission of C. diff, known as hospital-acquired C. diff. Typical prevention methods for hospital-acquired C. diff include isolation of patients, environmental cleaning, strict adherence to hand hygiene and contact precautions, as well as appropriate PPE use. The spread of the novel coronavirus SARS-CoV-2 led to shortages of PPE worldwide and an interest in how spread of other hospital-acquired infections changed in response. So the purpose of our study was to observe how the incidence of hospital-acquired C. diff changed in a 5-hospital healthcare system in Oregon during the COVID-19 pandemic compared to pre-pandemic times. We hypothesized that increased hygiene awareness and PPE use during the COVID-19 pandemic would contribute to an overall reduction in hospital-acquired C. diff incidence.
For our study, we used a cross-sectional study including data from March 2018 through August 2019 and March 2020 through August 2021. Data was extracted from electronic medical records from Samaritan Health Services, which included cases of hospital-acquired C. diff infection by month and number of patients admitted each month. The rate of hospital-acquired C. diff per month were calculated with odds ratio and confidence intervals, as well as linear regression models, and compared to pre-pandemic versus during pandemic periods. The study population included 51,616 patients admitted to 5 hospitals in the Samaritan Health System. There were 33 cases reported during the pre-pandemic timeframe and 44 reported during the pandemic timeframe, a 50% increase overall. There was no significant difference in the odds of hospital-acquired C. diff during the pre-pandemic period compared to the during pandemic period. As seen in the linear regression model fitted to Figure 1, the rates of C. diff in the pre-pandemic period shows a declining trend, and the rates of hospital-acquired C. diff infection during the pandemic shows stabilizing trend. Overall rates for hospital-acquired C. diff were 6.2 and 8.75 per 5,000 patients for the pre-pandemic and during pandemic periods, respectively.
So our data demonstrated that hospital-acquired C. diff incidence increased during the COVID-19 pandemic compared to pre-pandemic, although we did not find a statistically significant increase in the odds between the 2 time periods. Our study should be revisited in a few years to gain a larger sample size to more accurately identify if the trends of hospital-acquired C. diff in the Samaritan Health System hospitals have changed due to the pandemic.
Thank you for listening.